Hey guys, my name is Tiffany and welcome back to another video. So in this video, I wanted to share with you guys on whether or not you should pursue the NICU route versus the pediatric route.
'Cause anywhere with you feels right. Anywhere with you feels like Paris in the rain. Paris in the rain. When I'm with you, when I'm with you, Paris in the rain. Paris in the rain.
So I don't know if this video already puts me in a situation where I'm extremely biased, but of course I am a NICU nurse, so as you can see, I only deal with tiny people. I do have some experiences though where I did float to PICU quite often at my previous hospital, especially during the winter time, just because our census would usually be really low and I usually have to end up floating out. So I do have a little bit of experience in PICU and working with bigger patients. So I'm going to be talking about two reasons why people end up pursuing NICU versus PICU, and maybe this might help clarify for you whether this is a route for you to take. So I want to share with you guys a little background and history about me for those that don't know. I actually, when I was in nursing school, wanted to become a pediatric nurse. I was pretty adamant on wanting to work with kids. And so my set goal was to become a peds nurse. And I remember when people asked me what I wanted to pursue, certain specialties, I knew exactly in my heart that it was going to be peds. And then when my third year of nursing school hit around and we got to chance to do our clinicals and we did our peds clinicals, I hated peds. And we had some, shadowing here and there, and I got to work with different age range groups. But I had two experiences that stood out to me the most that made me really not want to do peds. One was that I had an experience where I was taking care of a toddler and the patient just refused their medication and would be screaming around the room, just running around, and I'd have to chase the patient to take their med. And it didn't end up working out. That I ended up having to give the med to the mom in order to get the patient to take it. So I just could not see myself, picturing myself running around to chase my patient to have them take a medication or just dealing with that kind of situation. I was just so distraught that I didn't know what to do and how to react to it. And that was my first time ever working with a toddler in a hospital setting. Of course, I know how to manage kids outside of that. Trust me, you guys, I've worked with kids pretty much my whole life. I'm the oldest in my entire family. And so I have watched kids growing up, and I used to volunteer with kids all the time. So I know how to interact with kids, but interacting with them in a hospital setting is completely different because of course they're terrified, they're scared, and you coming in directly at them to their face with a medication, obviously they don't want to take that and they're not going to do well. They're not going to take it well. So it was just a very distressful situation for the both of us, and I didn't know how to interact during that time. And then another situation that made me not want to do peds is that I actually had a patient who was in their teens, probably around 18 years old, and was refusing literally everything I would do. I needed to flush the IV because I needed to make sure that it was working, and it's of course part of one of the things we do in our assessments is to make sure that our IVs are patent. And so I had to check that by flushing the IV. And of course I had my preceptor with me, but the patient just refused literally everything. And of course, since they are teenagers, they can voice concerns and things like that, and they can refuse care. And so it was just super difficult for me to want to do certain things and have to do certain things for the sake of the patient. But they just were refusing everything that I just did not know what to do. So those are just two really bad examples of situations that I experienced. And I don't want to say everyone's experiences are all like this, but it was just those two that made me really reevaluate whether peds was for me or not, just because I didn't know how to really interact with different age range groups. But of course, I'm sure all those peds nurses that are peds nurses do it for a reason, and they do love that. They do love that they can actually talk and interact with their patients and really get to communicate with them, because that's how they're going to develop rapport. That's how they're going to be able to interact and learn more about, their pain levels and stuff like that. So going to the opposite version of that in the NICU, patients usually don't interact with you in a sense that you want them to, where they cannot communicate their pain, they can't talk to you. The most they could do is like coo and look at you and stare at you, but that's pretty much it. And so it can be really challenging, and that's where it can be difficult for NICU nurses, especially at the beginning, to learn critical thinking skills just because you have to figure this out all on your own. Like, no, there's no cues that the patient's going to tell you, like, I'm hurting here, I'm in pain here. Like, they're not going to tell you those things. So that's kind of where it can become a little bit challenging working in the NICU setting, just not being able to speak to your patients. But a biggest perk I'm going to say for sure is that I haven't experienced a situation where a patient refused something I did because they kind of have no choice. And as bad as that may seem, it's the truth. And a lot of times it ends up making it a lot easier for me just because I don't really have patients fighting against me in that kind of way. Like, trust me, we do deal with patients that are pretty strong and they could totally fight me physically if they wanted to. And so it can make it really challenging where I have to call another nurse along bedside and really hold my patient down if I have to do some sort of procedure or something. So it could be a 2-person job in that kind of way, sometimes even a 3rd person. A lot of times it does make it easier in a sense that patients can't refuse care. And so it makes it a lot easier. So kind of going back to which route should you pursue, whether or not you should pursue the NICU route versus the pediatric route. And honestly, it really just depends on the patient census that you want to work with. Just know that in NICU, a lot of times babies that come in are usually premature. So the smallest patient you'll probably ever take care of is maybe like a 22, 23 weeker, is the smallest patient I ever taken care of. And the biggest I've ever taken care of is about a 1-year-old patient, because typically after that, they usually get brought over to the PICU. So the most we ever get is usually 1 year old. And so I think for the first time I had a patient once where we actually fed them solids, and never in my nursing career so far have I ever had that happen yet. So I'm like, oh, that is how you know this patient is too old for this unit, because we typically don't feed solids to our patients, and that's just like pureed food or something like that. So it was a little bit interesting and a weird thing for me, but yeah, it's just one of those things that your patient population does get limited. So just know that. Versus in peds, you are dealing with a wide range of patients that you're going to be coming across. So probably the smallest patient you may get is probably a readmission of a NICU patient. So it could be a NICU baby that was able to go home and then had to get readmitted. And a lot of times they do end up going to PICU instead of NICU because they went home. So typically when they come back, they're considered dirty and not clean for our unit anymore. So they would go into the PICU. And so you may get some babies that are maybe like 1 month old is probably the youngest you may get. And then usually the oldest you may get is like 18 to 21. So when I was floating to the PICU, the oldest patient I ever got was a 21-year-old patient. And it was honestly not something that should have happened. I think it just ended up having to work out that way because other facilities weren't nearby or close enough for this patient to go to. So they ended up coming to our hospital, which was a pediatric hospital. But typically the oldest you will get is like an 18-year-old. So I've taken care of a 21-year-old before. I've taken care of an 18-year-old before. I've taken care of like 10 years old and 8 years old and kind of like anything below that. So it's all ranged everywhere. And so just know that you will be interacting with different age range groups. And so I'm going to admit my biggest challenge when I went to PICU was that I didn't know what was normal for each age range group. So I didn't know what normal vital signs were for a toddler versus for an 8-year-old or versus a adult, like an 18-year-old, 20 years old. I don't really know what is normal for that patient. So I'm going to be honest, I did ask a whole lot of questions just because I did not know what is normal for this patient. What are some normal vital signs that I should be seeing, and what is normal baseline for these types of patients? And then I'm sure peds nurses can tell you the opposite problem where they come to the NICU, and I do have times where peds nurses will ask me, is that normal? And so it's just one of those things that I'm sure like when opposites collide and you go in different worlds, you're kind of super lost and confused. So that's how I feel when I go to peds, and I'm sure that's how peds nurses feel when they come to NICU, that it's just a truly different world. And when they see these small little tiny patients, they get extremely nervous and scared that they like their big patients. And I'm the opposite way, where I love my patients super small. Like the tinier, the better for me. I personally love taking care of preemies a lot. So it really just depends, but that's one of the biggest reasons of either pursuing NICU or PICU is just really all about the age range groups that you want to deal with. And the second thing that I'm going to be talking about is diagnosis. So the next major thing that you need to consider is the different types of diagnosis that you will see. In the NICU world, the diagnosis that we usually see is very limited. So I did do a video already on the most common NICU diagnosis that you'll see. So make sure to check it out in one of the cards above. But yeah, we have a very small little group of diagnoses that we see often. And there's some that we see not so often, but I've seen enough to know now what types of signs and symptoms I am looking for. And that way it makes it a lot easier for me, especially during my early stages of being a new grad, that, the critical thinking part of it was always challenging. And as a new grad, you're already struggling with that a lot. But at least in NICU, you see things often enough that eventually you will develop the skills to pick out these certain signs and symptoms that you may see often in patients and recognize it earlier on. So it made it a lot easier for me as a new grad NICU nurse. But I will tell you, when I went to peds, I got so many different age range groups and different diagnoses for each group that it was just so surprising to me. It felt like I was back to nursing school again, where I was taking my peds course and we learned all sorts of different things. There's a little bit of a mix into the adult world as well, and you're going to get a lot of diagnosis that you will see further on. The older your patients get, you will see more like adult diagnosis. And so it can be a little bit challenging. Not only are you learning a larger age range group, but you are learning more and more diagnosis that you're going to see. So in a way, I know a lot of PICU nurses love that. They love the ability to know and learn more and don't feel limited to a small group. And you are going to develop your skills really well in the PICU, because you're just going to see so many different types of things. And so for those that do want to be more well-rounded, then I think PICU would be a great option for you, because it does give you a wider range of things you're going to see and more skills to really enhance on. Versus in the NICU, I will admit that I am very limited to that small little bubble of diagnosis that we see. And so, when I do go to other units, I do get confused about what certain diagnoses are that I've never heard of before. But so there's really pros and cons to both. And that's another thing to consider as well. So basically, in summary, what you really need to really consider and ask yourself is, one, what kind of age range groups do you want to really deal with? Do you like that your patients talk to you, or do you not like your patients talking to you? So that already there is an indicator for you. Another thing too is that for both sides, you will be dealing families, and of course families of children. It can be a bit challenging, a little bit more than maybe adult families, just because of course, if I had my own children, I would be extremely concerned when my child goes into hospital. So I'm definitely going to be asking a lot more questions. I'm going to be very concerned about things that you're doing, so I may be a bit more observant of the things that you do. And so I believe that people can see that as like difficult families and stuff like that, but honestly, in the pediatric realm, and NICU encompasses that also a little bit too, is that you will be dealing with difficult families, but it's really more about how you approach it. So I do have a video on that as well, and check it out in the cards above. But yeah, that kind of goes along with the world of pediatrics that you're going to be dealing with. But that's one of the biggest things to consider, is really the age range groups that you want to deal with. And then the second thing is diagnosis, and whether or not you want to be stuck in a little bubble or want to be more well-rounded and have more of an ability to grow in a different kind of way. So it really just depends on you and what you're interested in. But personally for me, this is just my personal experience, and reasons on why I love NICU so much is that I do love the fact that I can connect to my patients and the families. I feel like because my patients don't talk to me that much, I actually connect a lot more to the families. And of course, the patients are super cute, and you interact with them, and babies are just fun and adorable to be around. But I think the biggest part of it is that I love being able to connect with some of these families and get a lot closer to them, be involved in that plan of care, and be advocates for not only the patient, but for the families as well. So I feel like that makes the job more worth it to me, and why I love being a NICU nurse. And so that's really why I love NICU. And also for me, I do love the small range of diagnosis. There's still, even then, a lot of things that I don't know yet, and a lot of things I have to learn. So there are a lot of parts in my career that I still want to further advance and grow in. And even though I am 6 years into it, it may seem like a long time, but it's still a very small portion of the things that I can do on my unit. And so for me, I'm just going to say this, that I do see myself in it for the long haul at this point, and I do love it so much. I just don't know what else I could do at this point. If I wanted to consider pursuing outside of NICU, right now I'm going to say no. And I'm just going to say that NICU is definitely where my heart lays in, and so I just want to kind of further grow in this specific career field. But yeah, maybe in the far future, I may consider going to peds, and who knows, maybe that might be a world that I jump into, or I might be a NICU nurse for the rest of my nursing career. Who knows? But at least for now, this is where I'm at. So let me know down in the comments below if you like peds more or NICU, or which one you are considering if you are kind of in nursing school trying to figure it out. I would love to know. And I'll see you guys in my next video. Bye!
'Cause anywhere with you feels right. Anywhere with you feels like Paris in